Interviewing. Dizziness. Dizziness encompasses everything from a slight dizziness when getting up, with dots in front of the eyes that quickly disappear again, to extreme vertigo, where the room spins around and there is difficulty maintaining balance. The main differentiation of dizziness is between shu and shi conditions, whether there is enough qi, shu, or jing to nourish the brain, or something is blocking their movement up to the brain. Inquiry should be made about what triggers the dizziness. The dizziness comes when getting up. It is often due to shi chu and or shui chu, because qi and shui are not strong enough to ascend as quickly as a person getting up. In some situations, this can be due to phlegm blocking the ascent of qi and shui. Shui shu dizziness is often exacerbated during and after menstruation. This is because the woman is more shui shu due to bleeding. This type of dizziness is also common after childbirth. Shu types of dizziness are also worse when the person is tired after exertion and improve when the person has rested. If the dizziness comes when the person is stressed, frustrated, or irritated, it will be due to liver imbalances such as liver wind, liver fire, or liver yang rising. Liver fire will also manifest with a hot sensation in the head during an attack of dizziness. If the dizziness is worse after sexual activity, it will be an indication that kidney qing is not nourishing the brain. A sensation that the room is spinning round and it indicates wind phlegm. Sensations of nausea and heavy-headedness will also indicate phlegm. Dizziness is a visual distortion with a whirling sensation in the head. In mild cases, the patient will feel better after they close their eyes. In severe cases, the patient may feel as if she's riding in a vehicle or boat. The dizziness may even upset one's sense of balance or be accompanied by nausea, vomiting, sweating, or fainting. Many diseases in biomedicine, such as oral dizziness, cerebral dizziness, hypertension, hypotension, anemia, and neurosis with dizziness are their main symptoms, can be diagnosed and treated as dizziness. Definition: the general name for dizziness and vertigo. Dizziness refers to dim eyesight or blackened and blurred vision or spots in the visual field. This may only occur upon moving and last just a few seconds. Vertigo, on the other hand, is an inability to stand firmly because one's surroundings seem to be revolving. Vertigo and dizziness often appear simultaneously, in which case we simply call it dizziness. Etiology and pathomechanisms of dizziness. The two major causes of dizziness are a disturbance of the clear orifices brought on by the pathogenic factors or a lack of nourishment to the clear orifice. Dizziness is closely related to wind fire, phlegm, blood stasis, and deficiency. The clear orifice refers to the sensory orifice of the head and includes all 7 orifices as well as the brain. Pathogenic wind and fire tend to rise upward. When they attack the head, they disturb the clear orifice, which can lead to dizziness. Wind and heat can arise from either an exterior invasion or from a dysfunction of the Zhangfu organs, especially the liver, because it is the organ related to wind. Ancient medical books say that all wind, shaking, and dizziness pertain to the liver. The divine pivot. This says that the deficiency of the brain leads to dizziness. Deficiency of the brain can be caused by a lack of nourishment due to qi, blood, or essence deficiency, or it may be due to pathogenic factors such as blood stasis or phlegm obstructing the channels and collaterals. In either case, the qi and blood cannot adequately circulate and leading this to a lack of nourishment in the head. Ancient medical books say that without phlegm, there's no dizziness. Thus, phlegm is another major cause of dizziness. Dizziness and vertigo. Observation is dizziness when getting up. Significance is seizure, sway shoe, or phlegm. If there's acute dizziness, especially dizziness when lying down or sitting, there's wind phlegm. Dizziness accompanied by nausea or a heavy sensation in the head means there's phlegm. Dizziness and blurred vision, which is aggravated by exertion and when tired, means seizure, chi-shu, and shui-shu. Dizziness that is worse after sexual activity means kidney jing-shu. Dizziness and ringing in the ears, kidney jing-shu. Dizziness with loud sound in the ear or headache, liver yang rising. Vertigo with heaviness in the body or head means phlegm. Signs and symptoms of dizziness with descending pain in the head. There is paroxysmal dizziness and rotary vertigo, heaviness of the head, aggravated by notion, difficulty in thinking or concentration, especially in the morning, stifling sensation in the chest, nausea and profuse sputum. If there's dizziness and vertigo that feels like motion sickness, tinnitus, red face, irritability, distending head, symptoms aggravated by emotional stress, and dizziness after head injury accompanied by sharp pain, then the indication is an excess. There's wind phlegm or phlegm heat, liver yang rising, or liver fire blazing upward, blood stasis. Now, for chronic hollow and heavy sensation in the head, symptoms are dizziness with desire to lie down, worse in a standing position induced by exertion, dizziness which is worse when standing up from a sitting or laying position, blurred vision, persisting dizziness and vertigo with empty feeling in the head, worse in the afternoon and evening, aggravated by overwork or overthinking. There is a deficiency. First, there's chi deficiency. The second is heat and spleen blood deficiency. The third is kidney essence deficiency. Thank you for your attention.